So now I'm going to demonstrate how to put a resident on the bedpan who's unable to move. I do have the resident exposed for video purposes only. Of course, in the real world, you would not overexpose your resident. This video will not be showing the cleaning technique. It is literally showing you how to put someone who cannot move on a bedpan and then removing the bedpan. For our classroom purposes, the resident already has a pad beneath them. For your Florida CNA examination, you'd be responsible for placing the pad. One last reminder, you do not have to use this particular technique in order to put a patient on the bedpan when you're taking your CNA examination. You can use the easier technique, which is your resident raising his or her hips, you placing a pad in the bedpan, and then removing the items in the same technique or the same skill set. Now we're going to begin. I've lowered the head of the bed. We have our pad, and now I'm going to go to the cabinet and retrieve my items. All right, so I've lowered the head of the bed. We're going to go ahead and get started. I need to put our patient in a safe position. If I have him or her turn too much right now, they'd be too close to the edge of the bed. So I'm going to move him in increments and get him closer towards me. I'm going to use your shoulders. We're going to come up and towards me. Very good. I'm going to do the same with your hips and your legs. I'm going to cross the leg nearest me. I'm actually going to bend the knee, cross it over. And so now when I turn the resident, this knee is going to help him remain on his side. And something else I can do is just extend the forearm so that he doesn't roll on it. If your bed has rails, you can also ask the resident to hold onto the rail. On the count of 3, I'm going to turn you, okay? 1, 2, 3. Very good. Smooth out any wrinkles. Your resident should not have wrinkles beneath them. And remember, he's exposed for video purposes only. You will not overexpose your resident in the real world. I'm going to use a napkin, open my cabinet. I'm retrieving toilet paper and also the bedpan. For this particular skill, since the resident can't help, I'm not going to give him or her the toilet paper. However, I do have it near me so that I can use it whenever we're done with the skill. Whenever you're placing your bedpan, find the larger collection area that usually goes towards the thigh. The very top of the bedpan goes at the top of the hip. I'm going to push this under just a little bit, make sure it's centered. On the count of 3, come back towards me. 1, 2, 3. Get your hips on it. Okay. Are you okay? I'll get you recentered in bed once we take the bedpan out. I'm going to raise the head of the bed to make going to the bathroom easier. Before you leave your resident's bedside, make sure you give them the call bell. Of course, put the sheets back up. But for video purposes, we're just going to lay the resident right back down and take out that bedpan. All right, Patrick, I'm going to cross your leg. I'm going to secure this bedpan, and on the count of 3, I'm going to help you turn, okay? 1, 2, 3, turn. Notice how I held this bedpan down. Had I not, it could have tilted, and I could have gotten some of the moisture, the wetness, whether it was in urine or fecal matter, on my resident. You would finish the cleaning process. All right, let's go ahead and take it back. Remember, we're not going to overexpose our resident. He doesn't have to be perfectly neat right now. I can always come back and finish the process once I've finished emptying the bedpan. I'm going to empty the imaginary contents into the toilet. I'm going to use a napkin to turn on the water faucet. I'm going to rinse the bedpan. I'm going to pour the contents into the toilet. I am now going to cut off the water. I can use a different napkin in order to dry out the bedpan. And don't forget that for the state of Florida CNA examination, you have to use a napkin if you have your gloves on whenever you're storing your items. Make sure you also offer to wipe the resident before the CNA exam. As long as you give them toilet paper, the person will pretend to wipe themselves. All right, so now I'm going to recenter my patient back into the bed. Pretend that I have taken off my gloves, washed my hands, and applied new gloves. I'm now going to reposition my patient in bed. All right, so now I'm going to get you back centered, okay? If you can release the rail. All right, I'm going to bring you over. 1, 2, 3. Going to do the same for your hips. 1, 2, 3. And your legs. Let's keep these legs in line also. Sorry if I scratched you. That wasn't my intent. Are you still doing okay?
Mm-hmm.
Want to get that wrinkle out the bedding. You walk around. Hey Patrick, here's your call bill. Is there anything else I can get for you right now? Make sure you take off your gloves. Wash your hands. If you lowered the side rail, you would have raised it before you left your patient's bedside. If you brought the bed up to a working height, don't forget to lower it. Open up your privacy curtain, scan your room, making sure that everything has been cleaned and that the patient's right to comfort, safety, and privacy have been maintained. And if everything is done, you did a great job. All right, everybody, this is Eunice Mathis with Florida Training Academy. We look forward to seeing you in our next CNA training video. Bye-bye.